Hello, everyone, and welcome to this audio podcast. And this audio podcast as part of a Proxyl interlude or intermission. This audio podcast as part of a Cataclysm Chiasma, and this audio podcast as part of a this audio podcast as part of a Storm Robotics production, and this audio podcast as part of an interlude of in around this series. So this audio podcast, an overview in around collaborative works that have been put forward to the American Society of Nephrology 2023. And when collaborative works between academia and between academia, healthcare professionals, and two social media platforms, two leading social media platforms in around social media platforms for kidney care or nephrology. The works that was put forward to the American Society of Nephrology for 2023 was in around healthcare through audio podcasts and art, looking at sort of a perspective on CKD or chronic kidney disease, and a collaboration between the Renal Patient Support Group and the Kidney Disease and Renal Support Group, KDARS for Kids, and Storm Robotics Productions. So in around the introduction, CKD or chronic kidney disease is recognized as a silent, irreversible, long-standing condition, and tends to establish itself as a health complication and or a comorbidity. Service user access to educational support surrounding kidney care can be challenging between healthcare sectors owing to clinical environments. The aims around this works was to understand how audio and podcasts and art sort of offer collaborative basis for service users and service providers to align healthcare practices. The objectives around this was the audio podcasts and art have been focused between two leading education social media platforms to help highlight pertinent aspects surrounding healthcare and disease. And around the design around these works, the audio and podcast and art focus on healthcare on how healthcare professionals and service users could be working together through social media to improve experiences. And around the results of this, so collaboratively between the RPSG and and KDOS and Storm Robotics production, there is the usage of several social media platforms, including, for example, 4 YouTube channels and two SoundCloud channels with over 600 audio podcasts and educational webinars highlighting context and supporting service users and service providers surrounding nephrology, surrounding nephrology and pediatric nephrology, clinical medicine, and biomedical sciences. Audio podcasts and art can prompt service user and service providers to join up healthcare. In around the conclusions, the RPSG supports over 10,000 service users amongst the adult nephrology population, and KDARS is supporting near or over now 2,000 service users amongst the pediatric and young people population. Audio podcasts and art can help incorporate practice excellence. Some terminologies around this works: social media, audio and podcasts, online spaces, nephrology, and public health. That draws this audio podcast to a close. This has been an audio podcast as part of the Proxyl, the Proxyl intermission or the Proxyl interlude. This has been an audio podcast as part of the Cataclysm, Chiasma, and this audio podcast as part of this audio podcast as part of a Storm Robotics production, and this audio podcast as part of an interlude. Thank you.